Welcome to the State of Mind virtual speaker series. This series has been developed to provide education and support to youth, caregivers, and educators during this challenging time. This series is a collaboration between two local nonprofits, One in Five and MindPeace, and various community mental health partners. We're glad you're here to educate yourself and to learn how to keep your brain in a healthy state of mind.
Hi, I'm Dr. Scott, and I'm a psychologist at Cincinnati Children's Hospital. And today I wanted to spend some time talking about African American mental health, and specifically mental health among African American youth. So you may or may not know this, but over recent years we've seen an increase or an uptick in suicidality among African American adolescents. So what the data shows is that from the year 1991 until about the year 2017, we actually saw a 76% increase in the number of attempted suicides among African American adolescents. Now, that's a pretty startling statistic and really speaks to the need for increased awareness about mental illness within the African American community, but also exploring, issues of stigma and some other barriers that might be in place that might prevent folks from getting help if they need it. So what we do know is that these disparities do exist in help seeking. So what does that mean? Basically, what it means is that while African Americans are just as likely as other groups to experience mental illness, including anxiety, depression, and other concerns, they are actually less likely to seek professional help when needed. And so a lot of research and discussion within the mental health profession has been completed to try to find out or discover, what are those things? What are those barriers that kind of get in the way of folks getting the help that they need when they need it? So I'm going to explore a little bit of that with you today and hopefully provide some helpful information in your decision making so that if you have been thinking about or struggling with some symptoms that you want to get help or get some advice about from a professional, that you might be more encouraged to do that. So what are those barriers? So the number one thing that we found that influences or impacts an individual's decision to get help is, access. Do you have mental health services available in the area where you live? So that is one concern that a lot of folks are facing. The other concerns have to do with the cost of services. We do know that still, within the U.S., there are about 11% of African Americans who do not currently have healthcare insurance. And so with the limitations on coverage and things like that, the cost of services can create quite the barrier to a person seeking out and receiving those services. The second barrier or issue that we've seen that prevents folks from seeking help is stigma. So, in the African American community especially, mental illness or the discussion of mental illness can be quite taboo. A lot of folks, kind of see mental illness as being like a personal weakness or, this thing where, you consider yourself to be crazy if you're dealing with any kind of mental health concern. And especially given the history, of African American people, you think about the fact that, Black people have survived slavery and, segregation, all these different kind of, horrendous historic events. And so the assumption is that, if we can survive that, we can survive, a little of anxiety. We can survive a little bit of depression. But in fact, these can be really debilitating conditions if left untreated or unmanaged. So that can be one, specific area where it can have an impact on the decision to seek help. Other things are just a lot of times we find that African Americans do seek help through their faith-based community. So we do find that a lot of times people go to the church or religious figures in order to get help with mental health concerns as opposed to going to a medical professional to get diagnosed with whatever their specific concern might be. And while your spirituality can be a big factor in overall coping and management of, emotional distress and all of those things, and can actually be included in your treatment plan, if you're dealing with more significant mental illness, it is definitely a great idea to reach out to a professional who has expertise in managing those concerns so that you can either get the therapeutic help that you need, or in some cases, medication for the management of those concerns. Other things that might be influencing the decision to seek help have to do with just a general mistrust of the medical and mental health profession. And, we think about the fact that African Americans oftentimes, if you go to the doctor, you feel like, well, maybe they are going to think I'm crazy, or maybe they're going to misdiagnose me, or, there's some concern about how that visit might go. And this is not unfounded. There is actually a history of mistreatment or maltreatment of African Americans in the medical field. If you think about like the Tuskegee experiments and things like that, and also within the mental health profession. And so there has been this historical kind of defensiveness that African Americans have developed with regard to visiting doctors' offices and seeing providers, especially if those providers do not look like them. And so, but I want to kind of leave you with a note of like hope in that area. Many programs, especially training programs for medical professionals, and I know for a fact for mental health professionals and licensing boards, do require that providers have training in cultural competency. So that's something to definitely just kind of note that in recent years, those changes have been occurring across time because these things have been observed and noted and researched. And so there's a lot of force or push in that area to make sure that folks are getting competent care. So when you think about approaching the decision to seek help, kind of what do you consider, what do you think about, and how do you even go about it? Well, one thing you want to consider is just to kind of first explore, what your own biases and your ideas about the stigma around mental illness are. So, what do you think about, the fact that you could potentially have a mental illness, and, try to get through those or work through those specific emotions so that you can take the next step, which is to talk to an adult that you trust who can give you good advice and support you through the process of seeking help. Now, one thing you want to think about is, how do you even start the process of talking to your provider about the issue of race or, and how that might impact your treatment? It is absolutely okay to talk to your doctor about their, training or their background in cultural competency. So you certainly can say, hey, how many African American patients have you treated? Do you have a lot of experience dealing with multiple, cultural backgrounds? What specific training have you had in cultural competency? And really what you base your decision off of is, one, do you feel like you were respected? Do you feel like you were given, dignity during your visit? Do you feel like that this provider understands and can relate to your needs? And so that's really what you should use to kind of influence or impact the decision to either, maintain those services with that provider or to continue to look for a provider who might be a better match. But if you find that, the provider that you're speaking with, kind of is a good fit for what you're looking for, then by all means, seek out those services and make sure that you kind of maintain that connection.
A special thank you to our State of Mind speakers and to you for joining us. More videos and educational resources can be found at 1in5's website. If you feel like you or your child is in need of professional support, therapists are available. Please refer to MindPieces school-based or community resource page. For a mental health crisis or emergencies, patients and families are encouraged to contact their current mental health provider first. This allows the mental health provider who knows your child best to provide support and direction. If your child does not have a mental health provider and they are experiencing a non-life-threatening mental health crisis, you are encouraged to contact the Psychiatric Intake Response Center at Cincinnati Children's Hospital Medical Center. 513-636-4124. Call 911 or go to the emergency department if you are experiencing a medical emergency, a life-threatening mental health crisis, or are directed to go there by a medical provider. This will help limit the spread of COVID-19 in our community and allow our emergency departments to care for patients with the most critical needs first.